All right, it looks like we have a good number of people here, so let's get started. Good evening and welcome to A Catholic Case for Comprehensive Sex Ed for All, a 1 hour long webinar during which we'll talk about the importance of access to comprehensive sex ed and why Catholics should care about supporting and advocating for these issues. We know that Catholic social justice teaches that healthcare is a human right, and that includes sex ed, contraception, and abortion care. The values of dignity, compassion, and justice, and respect for all of our neighbors compel Catholics to fight for everyone to make healthy and informed decisions about sex and relationships. Comprehensive sex education is essential to care for the whole person, body, heart, and mind. But misinformation and stigma about reproductive health care and sexuality prevent us from understanding the basics, which puts many people at risk. This is especially true for young people, those raised in religious communities, and people who have attended religiously affiliated schools. My name is Marley Breakstone. I use she, her pronouns, and I'll be moderating today's conversations. I'm the State Policy Associate here at Catholics for Choice, and I'm really excited about this evening's program. To start off, we'll talk a little bit about policy. We'll hear from experts working at the national and the state levels to advocate for comprehensive sex ed. We'll talk about why access to accurate, fact-based sexual health information is vital for people of all ages, but especially for young people, and learn more about what it is that's actually taught as part of a comprehensive sex ed curriculum. Access to comprehensive sex education is a blessing, and it affirms the morals and values that Catholics are called to live by. But we're not only here to talk about sex ed tonight, we're also here to learn the facts so that after this webinar, when you go out into the world and you fight for policy change and access to quality sex education, you know exactly what it is that you're advocating for. In the latter half of this webinar, an amazing sex educator, Tara, will join us for a lesson. For some of us, this will be a refresher, and for others, it'll be entirely new information. So to kick it off, we'll hear from Nawal Umar, policy analyst at SIECUS, Sex Ed for Social Change. She's responsible for tracking and monitoring state, local, and federal policies and impending legislation related to sex education and other progressive sexual and reproductive health issues. She's also responsible for developing and managing several SIECUS publications and providing general assistance and support towards advancing key initiatives at SIECUS. Her research interests include advocating for comprehensive, inclusive, and culturally responsive sex education, reproductive justice, and resolving sexual health disparities. Her previous experience includes working as both a sex educator and a health educator, as well as being involved in qualitative public health research. Then we'll hear from Evelyn Delgado. Evelyn is the executive director at Healthy Futures of Texas, whose mission it is to support the development of teens, young adults, and strong families to positively impact the future of our community by reducing teen and unplanned pregnancy in San Antonio and Texas. Evelyn serves as the chair of the Texas Women's Healthcare Coalition, a Healthy Futures statewide initiative that advocates for access to preventative healthcare. Evelyn has extensive experience as a senior public health executive at the Texas Department of State Health Services, overseeing women's and children's health programs that annually served 1 million Texans, delivering $950 million in public health services. Then we'll have a brief Q&A and we'll transition into the sex ed lesson with Tara. Before we get started, let's just quickly go over some general logistics and housekeeping. If you have any questions or concerns, you can type them on Zoom and submit them. Like I said, we'll have a Q&A portion, so if you have questions, you can submit those on Zoom as well. If there's any disruption or harm in any way, we can and will remove you. And lastly, this webinar will be recorded and sent out to registrants in the coming days. It'll also be available on YouTube should you want to revisit it or share it with someone you know. So now that we've got that all covered, Nawal, why don't you start us off?
Thank you so much, Marley, especially for that introduction. Hi, everyone. Oh, I see Marley, it says that you might need to give me access to screen sharing. I just checked right now. But glad to be here. Okay, let's see if it works now. Okay, yes, it should be working. And give me a thumbs up if everyone can see that. Okay, awesome. Thank you. I realize that it's just the panelists that I have in vision, but anyways, so getting started. So the case for comprehensive sex education, looking specifically at state and federal policy. So who I am, Marley already gave me a great introduction, but my name is Noel Umar, she, her pronouns. I'm a policy analyst at SIECUS, where I spend most of my time tracking state and federal policies related to sex education, as well as other interrelated sexual and reproductive health issues. While at SIECUS, I write our legislative summaries, reports, policy briefs, as well as our state profiles. And beyond my professional career, my background is in public health, as well as in understanding health disparities. I also have an interest in advocating for sex education within faith-based communities, given my own upbringing as a Muslim and Pakistani American. So next, who is SIECUS? Who do I work for? So SIECUS, Sex Ed for Social Change, was founded in 1964 by Dr. Mary Calderon, who was a medical director at Planned Parenthood Federation of America. And while there, Dr. Calderon became concerned about the lack of accurate information available about sexuality for young people. Fast forward to now, SIECUS advances sex education through advocacy, policy, and coalition building efforts. SIECUS envisions an equitable nation where all people receive sex ed, are affirmed in their identities, and have the power to make decisions about their own health and well-being and pleasure. We also believe that comprehensive sex ed can be a vehicle for social change as a means of building a foundation for a long-term cultural shift that will positively impact all levels of society, particularly issues of gender equity, racial equity, consent, and bodily autonomy. So what do we do? On the policy and advocacy front, we educate advocates on providing sexual health information at the federal, state, and local level. We monitor legislation related to sex ed and other interrelated issues, as I mentioned before. We provide technical assistance to state partners and work within coalitions with other organizations to advance sex ed policy. And we publish reports, data, and analysis to inform policy and advocacy work and understand the current state of sex education. On the education and resource development front, we publish toolkits and provide training opportunities for current sex educators as well as advocates. We also partner with organizations to promote and improve current sex education standards, such as the Future of Sex Education Coalition and the Sex Ed Collaborative, and the partnering organizations are mentioned on the slide. On a communications front, we educate and inform the broader public through media appearances, speaking engagements, and other high visibility activities. And we also expand our communication channels with our partners using both traditional and social media platforms to educate, inform, and mobilize communities. And thank you for sharing that link, Marley. And then lastly, we also manage Sex Education Policy Action Council, also known as SAPAC. So SAPAC is our membership-based council that's made up of sex education advocacy organizations nationwide, but it's not limited to sex education advocacy orgs. It also can include reproductive justice orgs, reproductive rights orgs, domestic violence prevention, all kinds, anyone who's interested in sex ed advocacy. And at the center of SAPAC is the opportunity for our state-based partners to connect and learn from other state organizations and experts via our facilitation to help shape a common narrative to advance comprehensive sex ed at every level. And so some of the events that we hold include Sex Ed Week of Action, and we also have our upcoming event next week, actually, Sex Ed on the Hill, which is our annual lobbying conference, where we have Hill meetings with Congress members or staffs of Congress members to promote REA, which I will be talking a little bit about later, which is our federal legislation. And if you're interested in joining as an organization or as an individual, I'll post our Google form in the chat. So just a review of what exactly is comprehensive sex education. So according to the National Sex Education Standards, comprehensive sex education is instruction within sexual and reproductive health knowledge that, among many things, is evidence-based, age-appropriate, culturally inclusive, trauma-informed, sex-positive, and can cover a variety of topics such as the ones mentioned on the slide. And this is vastly different from abstinence only until marriage education, which teaches abstinence as the primary or only method of preventing STIs and unplanned pregnancies, and as the expected standard before marriage. Now, some harmful implications of this education is that it can be heteronormative, discriminatory of LGBTQI+ identities, stigmatizing of adolescent sexual activities, so sex negative, and it can fail to teach about contraception, consent, and other important information, such as where to even access sexual and reproductive health services. And it also lacks evidence in preventing poor sexual health outcomes and sexual risk behaviors, such as the onset of sexual activity, STI rates, or rates of contraceptive use compared to comprehensive sex education. So with that, what is the current sex ed landscape across the United States? So there's a lot of number on the slides, but I'll kind of explain each one. So there's 29 states and the District of Columbia that require sex education to be taught. Now, this is not necessarily comprehensive sex education. This is just any form of sex education. 30 states require schools to emphasize the importance of abstinence when sex education is provided. 16 states provide abstinence-only education. 6 states explicitly require their instruction to discriminate against LGBTQ+ communities. 5 states, and only 5 states, have laws that require comprehensive sex ed. Now, of these states, 3 of them, I believe it's Oregon, Washington, and California, require comprehensive sex education to be taught in all their schools. And 2 of them require sex education curriculum to be comprehensive if it is already being taught in schools. So clearly this shows the patchwork of varying sex ed policy across the country that leaves young people on various different planes of understanding and knowledge of sexual health information. And after the recent Dobbs decision and state battles over abortion care currently, we anticipate this education being changed across the nation as we speak. So getting into legislation now. So this is an overview of the legislation that we tracked in this past year. And this is up to date as of our mid-year report release, which was July 2022. So there was 87 bills introduced that were related to sex education, 40 of which were positive, 42 negative. And 5 of these were passed or enacted, 2 of these were being positive and 3 being negative. So these bills reflect various trends, such as efforts to mandate comprehensive sex education in schools, trying to improve curriculum to include consent, dating violence, assault prevention as part of the curriculum, advancing requirements for sex education by making it medically accurate, age appropriate, culturally responsive, or otherwise closer to the national sex education standards. But it also reflects some negative trends, including opt-in requirements, increasing unnecessary parental involvement within curriculum development, and restrictions on funding schools that contract with abortion care providers, such as Planned Parenthood, and prevent them from providing sex education. Further, in the face of the Dobbs decision, we do anticipate further attacks on abortion care providers and also agencies that promote or support abortion care being prevented from providing sex education within schools, as well as attacks on what can even be taught in classrooms related to pregnancy outcomes. However, there's also some hope that with the 2 positive bills that were passed and many introduced, that there will also be attempts at improving sex ed curriculum to be more comprehensive and all-encompassing of pregnancy outcomes and stigma-free. Beyond this, SIECUS also tracked 382 regressive bills. And while the reason for me introducing these bills is that the number of sex ed bills this session were actually greatly overshadowed by the excessive amount of the following regressive bills. And while they don't directly call out sex education, they definitely have the potential to impact it and other forms of inclusive sex education or inclusive education in general. And these also don't include the multitude of attacks on abortion, which Guttmacher's legislative tracker we always refer to. And it's also important to note that many of these harmful pieces of legislation are introduced by the same opposition groups that are introducing anti-abortion and anti-sex education legislation. So clearly showing that there's an agenda to attack not only reproductive rights, but overall rights of young people. Thus, it's not only important for us to strategize it's important for us to strategize and defend against all such attacks because they're all interlinked with one another. So with that information, what can we do? So on the federal level, one of our asks is that supporting appropriations, so increasing funding for existing programs such as Teen Pregnancy Prevention Program, Personal Responsibility Education Program, and DASH funding under CDC, which currently they fund evidence-based sex ed initiatives across the country. And then in addition to that, eliminating harmful Title V sexual risk avoidance programs, which is just another fancy name for abstinence-only programming. And one way to do this is through what I mentioned before, REA, the Real Education and Access for Healthy Youth Act, which is the federal legislation that we at SIECUS are pushing for, which would create the first federal funding stream for comprehensive sex ed, and it would eliminate federal funding for abstinence-only programming or sexual risk avoidance programming. In addition to this, it would increase access to sexual and reproductive health services, especially for marginalized communities such as BIPOC and LGBTQIA+ youth. And currently there are 13 co-sponsors, I believe, in the Senate and 85 in the House. So still a ways to go. At the state and local level, one thing that we advocate for often is incremental change versus all-out comprehensive sex ed mandates, because we recognize that it's not always feasible to get those passed, especially given the current political climate. So advocating for things like improving medical accuracy of curriculum, making sure curriculum is evidence-based, as well as rescinding any sort of discriminatory or LGBTQ+ exclusive mandates within states. Additionally, improving what is being taught in the curriculum, so adding consent education or dating violence prevention education to current curriculum. And then lastly, advocating for the Healthy Youth Act, which is our model legislation for comprehensive sex ed that can be applied in various states. And then on this local and district level, we highly recommend using our community action toolkit, which I'll also link below in the chat after my presentation, and working with your local school board to improve current sex ed curriculum, as well as involving local organizations and building coalitions within your community. So reaching out to your parent-teacher associations, teachers unions, youth serving organizations, student activists, family planning clinics, and even faith-based organizations. And then finally, opportunities to engage with SIECUS specifically. One I mentioned, of course, was SAPAC. Besides that, we also offer technical assistance if you're trying to get sex ed legislation passed within your local communities or within your state. We also have our C4 sister advocacy organization, Educate Us, which engages more directly with electoral advocacy and school boards. And then we also have our SIECUS toolkits, like the one I mentioned before, but we also have an Educate Us one that would give tips for parents if you want to speak up for sex education. And then we also have our social media, which you can follow to stay up to date with whatever we're doing right now, as well as get alerts on whenever it's legislative session, and we have action alerts, etc., how to get involved with that. And that is all I have for you. So I know there'll be time for Q&A later, so I will yield the floor to Evelyn.
All right. Let's. All right, we're ready to go. That was really interesting. And I was like, yay, there's a whole federal effort out there to do this work. And it's amazing how you are tracking across the states, and so much sounded familiar for Texas. So in Texas, we have lots of challenges. I'm sure lots of states do too. We created Texas is Ready. Healthy Futures of Texas is the organization that I'm with. We're a nonprofit organization that's been in Texas since 2006, initially intended to address unplanned teen pregnancy. Our founder was a physician and decided to leave that work in order to create this nonprofit work. And so it's been a wonderful ride, a hard ride, I would say. But we are making progress, and there are so many challenges coming ahead that we need to just keep a steady path forward with anything that we can do to advocate for comprehensive sex education. So Texas is Ready is the Healthy Futures of Texas effort that we created a couple of years ago to work with the State Board of Education as an advocacy organization when the State Board of Education was making changes in Texas. So you can go to texasisready.org, and the tools there are to help school districts as well as communities implement high quality sex ed. There's quite a few tools in there that you can look at if you're a state that's looking at advocacy, if you're a parent that's looking at advocacy, a nonprofit, a school district. So, excuse me. Hold on there. So in Texas, just a little bit of landscape. Texas has the 9th highest rate of teen births nationwide, and this is with 2020 data. So about 2.3% of Texas teens gave birth in 2020. 17% of Texas teen births are a repeat birth. This is a very concerning percent there because of all the impact that you see on families when there's a repeat teen birth. And that is the highest rate nationwide. So Texas is trying to address that. Rates of sexual activity are declining slightly, but half of Texas high school juniors report, and almost 2/3 of high school seniors report having been sexually active. So this is a young population that needs sex ed before they've gotten into their higher high school years as juniors and seniors, for sure, before being seniors. And though teen birth rates are declining, rates of STIs are rising across the nation and as well in Texas. So why sex ed? Research shows that comprehensive sex ed can help reduce sexual risky behaviors, increase protective behaviors like condom use and supporting healthy relationships. Sex ed doesn't make you more likely to be sexually active. I know there's always some concern from people when we talk about sex education that if we introduce that information to young people, that they're going to be curious and they're going to therefore become sexually active immediately as a result of receiving sex ed. But this is not true. And we find that youth who have evidence-informed, evidence-based sex ed that's appropriately delivered in a way that youth can receive the information, that it actually does delay sex initiation, and it increases the chances that they will be using condoms. And also the healthy relationships part is so critical, because it's not just about sex, it's about power, it's about relationships, and all that goes into a relationship that will determine how and when a young person becomes sexually active. They have a right to learn about their health and how their body works. It's amazing, even in the community colleges where we serve 18, 19-year-olds, how many of those students, when we provide sexual health education, don't know about their anatomy. They don't know about their body and how it works. And then it's hard until you know that, how to know how pregnancies occur and how contraceptives work, so that you can pick the most effective contraceptive method for you if that's where what you're choosing to do. So, but it shouldn't be a surprise, because if you're not getting that information, quality information in high school, then you're entering a community college or university level of environment without having that important information. And we know that in Texas, 63% of our community college students, if they have an unplanned pregnancy, they don't continue with their educational plans. And then high quality curricula are age appropriate and medically accurate. So in Texas, what's happening? So in November of just a couple of years ago, 2020, for the first time in more than 2 decades, so can you imagine 20 years without updating health education standards? The State Board of Education, or the SBOE, finally decided that they were going to review the health education TEKS, the Texas Essential Knowledge and Skills, which is what tells teachers what they must teach in their classrooms. So school districts now are implementing those new standards in the 2022-23 school year, which is now. And so we were so ecstatic when the State Board of Education decided to look at health education, and we knew it was a once in a lifetime opportunity almost, because who knows, it might be another 20, 30, who knows, years before these health TEKS are revisited. So we wanted to take this opportunity to advocate as strongly as possible at a state level and engage communities and parents and our medical community and so many more people to help us in advocacy. But it was all a very planned activity. Advocacy is not just, I'm going to show up kind of thing. Advocacy is coordinated. It's acquiring the knowledge and knowing how to express what needs to be done once you're putting yourself out there. So the new TEKS is now offered in middle school, which is wonderful because in Texas, health education is required in middle school, but it is not required in high school. So we need this comprehensive sex ed to be as evidence-based, as quality and everything as possible for those middle schoolers, so that they don't become those juniors and seniors that are sexually active without any kind of protection. So the new TEKS include puberty, menstruation, anatomy, and reproduction. Things that I said earlier are really important. Continued strong focus on abstinence, but also contraception, condoms, and STI prevention, screening, and treatment. And always information about healthy relationships. We have been strengthening that aspect of our sexual health education because that's what students tell us they need to know about. And based on their questions, we know that they are struggling with some of that. The new TEKS, though, does not include consent, information about consent. We worked hard as an advocacy organization in partnership with so many people to get that language in there. But there was so much misinformation, I think, or maybe not even misinformation, just a refusal to go there with consent. There's not, it doesn't include information on sexual orientation or gender identity. And again, it wasn't for the lack of advocacy. There were hundreds of people that testified during this whole State Board of Education process. And there were people representing all paths, you know, and teachers and students expressing why sexual orientation and gender identity was important to be included. But the way we're looking at it is we made lots of progress. And we are really proud of the progress that we did by working with all of our community partners. And these are minimum standards. Districts can choose to teach more than what's on the TEKS. So also in Texas, following it, there was a new law adopted last year. Texas is one of just 5 states that's requiring opt-in for sex education. We were previously opt-out. So parents would they would be aware that their child was going to get sexual health education, and they unless they said, no, I don't want my child to get this, that child would get their sexual health education in school. Now they have to opt in, and that is so problematic because of just the process of opting in. There are so many opportunities for a parent not to find out that this has to be approved and they have to opt in. And we're in Texas, the only state requiring opt-in for abuse prevention. That was like a crazy one for me. Like, why would you require opt-in for abuse prevention? But that was something we really, just kept wondering about. But that's what it is in Texas. Is sex education controversial? People always say, yeah, it's so controversial, I don't even want to go there. But public opinion polling consistently shows that a majority of parents support sex education for their kids. And if students don't receive the medically accurate information from reliable sources, then they'll seek it out from friends or online. And they tell us that in surveys. They tell us that's where they go, and they think they're getting what they need when they go there. And schools should be transparent and seek community input because the community knows what they want for their kids. The other thing is that, politically, what happens, but 72% of Republicans, and we did, as part of our advocacy, we did a survey, we hired a lobbyist consultant, but along with they agree that along with abstinence, sex education in public schools should teach students about condoms and contraception. Am I messing with everybody when I'm moving this around? I'm sorry, hold on. So even though a large majority of parents support sex ed, a vocal majority in Texas, similar to what you were talking about nationally, there is a vocal minority that will always show up at the Capitol, always show up at school health advisory committee meetings or at school board meetings. And it's very disappointing sometimes because those voices are heard and they're organized. And so that's why we're constantly saying to ourselves, we need to be organized. We need to help people be good advocates. We need to give them the flyers, the briefing documents. We need to give them easy places to go so that they can have the right words to use when they're advocating. So who should advocate for sex ed? This is a list here that's very true. When we testified at the State Board of Education hearings, and I also served on some of their work groups, community work groups, they were called expert panels. When we showed up to testify, it was students, teachers, nurses, doctors, social workers, faith community, business community, everybody. And there were parents that came. So really everyone can advocate for sex ed because everyone has a story to tell from their perspective on how they interact with young people. Young people say they want to hear about sex ed from their parents. Parents say they want to be able to provide it to their children. And then they also want to hear about sex ed in their schools. And they say they want, at least in Texas, they also want to hear it from their medical providers. So, we encourage medical providers to provide that adolescent-friendly, private clinic time so that they can have that one-on-one conversation about anything that is related to their sexual health. And then we want the schools to have the best curriculum possible when they're teaching their young people. So this is, again, why we did Texas is Ready. These are things that we say people can, language they can use. Sex education can delay the onset of sexual activities. And we know 2/3 of Texas high school seniors will be sexually active. So we want to make sure they have all this accurate information. And then as a last slide, so what rights do parents have in Texas? They have a right to have a say in the sex ed curriculum that's adopted. They can have public comment. They can go to the school health advisory councils, which in Texas are required, that every school district has. They have the right to stay informed about what's going on in their school, the district, their board, and they can decide whether or not they want their child to have sex ed or not. They have the right to receive notification of the sex ed that they will be provided and be able to review materials. Parents may also be able to be involved by communicating frequently with teachers, counselors, school nurses, and administrators, and participating in events, advocating with the legislature. The legislature listens to parents, at least to some extent, and then serving on the school districts, any kind of board that they have that makes decisions. Like there may be some parent organizations. Again, in Texas, is the School Health Advisory Council, where the public can join and be involved and help influence the direction of sex ed that their school district decides to take. Or, running for a seat on the school board, where you can really make some impact in working with fellow school board members. So lots of challenges ahead still, but we were so proud of having made, significant changes through the State Board of Education this year. It wouldn't have happened without very organized advocacy, without having contracting with a lobbyist to be able to do some of the surveys that we needed to show what Texas thinks, and then just engaging all of our partners, our medical community, Texas Medical Association, the Pediatric Society, teacher organizations, parent organizations. So a lot of focus, but it can be done. And I think that moving ahead, we have to do it, because without advocacy for quality sex ed, then the other voices will take over, in my mind, and there won't be a counter story to tell, and decisions could go way differently than they went this last State Board of Education review cycle. Thank you very much for having me.
Absolutely. Thank you to both of you so much for all of that information. We have time for only 1 or 2 questions because I want to make sure that we can get the entirety of the sex ed lesson fit in here. But for the first question, Nawal, I know you mentioned this a bit in your intro, but as a person of faith, why do you advocate for access to comprehensive sex ed?
Sorry, it took a while. I was trying to find my unmute button. So I think it's really important to me because growing up, especially within the Muslim community, I think there was a lot of, like Evelyn mentioned, misinformation and fear about what sex education entails, and especially what comprehensive sex education entails. Like, is it culturally responsive? Like, can you have your own values but also learn about sexuality in an all-encompassing way? And because of that, there's a real lack of discussion about it in the Muslim community. And I definitely felt that growing up. And I know anecdotally that within my community, whenever people were ready to engage, in sexual relationships and relations in the future, they felt really unequipped and unprepared, including myself. And a lot of the sex education I received, unfortunately, because of that, was either through online, through peers, or not until I was in college, which left me definitely very unprepared compared to my non-Muslim counterparts. And I think another thing that is sometimes very prominent is also the role of like sexual guilt that can be at play within faith-based communities, like with this misunderstanding that knowing information about our sexuality is inherently wrong when that's not the case. And I think that can then have lasting impacts on sexual dysfunction and so many other aspects of your well-being in the future. That for me, that was when I first got that experience and I got that education, it was really enlightening. And I felt like it was something that I wanted to take back within my own community and create this generation of like sex positive Muslim youth. But yeah, that's where it kind of started for me.
Wow, thank you so much for sharing that. We're a little bit short on time, so we're going to hold any more questions, see if we have time at the end, and we can follow up over email after if there are any lingering questions as well. But thank you again. I'm so glad that we're able to have this conversation about policy, especially through a faith lens, when there's so much going on about reproductive health rights and justice in our country and in the world right now. So let's transition now into Tara's presentation. Thank you so much for being here. So Tara Michaela Jones is a Black queer student and sex educator who's based in New York. She's currently in the process of earning a bachelor's degree in gender and sexuality studies from NYU, and also works with Belesa in their sex toy boutiques influencer marketing team, as well as with Chelsea Lebo Communications as a video content creator. Her work focuses on how injustice manifests in sexual interactions, specifically racism and racial capitalism. She also explores how stigma keeps us all from being our best selves and how we can close the orgasm gap. So after creating her Instagram in 2015, which documented many of her adolescent struggles in exploring sexuality as a young Black woman, accepting her body and experiencing shame as a young Black woman, she realized she had the potential to become a go-to person in her community to openly discuss these issues with her peers. And she continues to use her digital platform and written pieces to connect with those around her. So thank you again for being here, and take it away.
Amazing. Thank you so much for that introduction. And thank you so much to everyone who spoke before me. I feel like I learned so much. I spend most of my day talking about sex on Instagram. So actually knowing what's going on at the state and federal level is fascinating to me, to just get this information into our schools. A lot of what I do is trying to supplement what people didn't get from grade school. So a lot of my work centers young adults, Gen Zers, millennials, folks like that who have more access online, and so I try to reach them there. So that's me. I think screen sharing might also be disabled for me. Okay. Let me figure this out. Oh my gosh. Okay, a little technical issue. It's like not allowing me to share. Give me 1 second. So sorry. Okay, this is super weird. Sorry, I have no idea what's happening. Um, one second.
Maybe we can present without the slides, and then if you want to send them to me after, I can send them out.
Yeah, I was thinking that. Yeah. I missed my slides, but we'll continue. So as we mentioned, I'm a New York-based sex educator. I am actually a recent grad of NYU, so right now I'm doing this full time, just working with people digitally, and being around for my community to be able to answer everybody's questions about sex, because really, this is lifelong work. My favorite part of my job is that I feel like as much as I learn about sex, I'm only like maybe 5% into what there is to know about sex in total, because everybody defines sex differently. And there's just so much to know, especially considering sex research is a relatively new field, especially around people with vulvas, and it's a constantly changing field. I mean, we look at the fact that transness was considered a mental condition until 2013, so there's so much change happening actively around what we know about sex, sexuality, gender, and so it's lifelong work for me. I did have a slide with a bunch of book suggestions, other podcast suggestions, stuff like that, because I do think it should be lifelong work for everybody. So my next slide. Honest and accurate anatomy. So I had an example of how of homologs. Essentially, the concept is that up until a certain point in utero, everyone is biologically female. And so that means when we're looking at our sex organs, our genitalia, these things are sort of the same parts that develop differently, which is a very helpful way for me to understand my own anatomy and the anatomy of others. So homologs refer to the parts that sort of link up together. So the clitoris, for example, is a homolog for the head of the penis, the shaft, a homolog for the labia, testes, the overall homolog for ovaries. I also had an example of the clitoral network. As we understand the clitoris, it's just sort of the one little button at the top, but really it extends all the way back. It can be as long as, I believe, 5 inches all the way back. And so that network is really important to understand as far as G-spot stimulation, and sort of as far as these narratives that we're told around the female orgasm and the idea that penetrative sex is supposed to be this end all be all, when that's really not the case. Over 70% of vulva owners require clitoral stimulation to be able to orgasm at all. And so we need to start moving away from this very narrow definition of sex as penis and vagina, and moving towards something more expansive, something more imaginative, and explorative. We also, I believe, need to move away from pet names when we think about the way that we learn about these things as children. The stigma is only worsened when we're calling our body parts our hoo-has, when we're afraid to say the word vagina, when we're afraid to say vulva. People don't necessarily even understand that the vagina and the vulva are not the same thing. The vagina refers only to the canal, the vaginal opening, and the vulva to everything else. Your inner and outer labias, urethra, everything there, mons pubis, everything there. And so I think anatomically accurate language is so valuable, especially when we think about, like sex education in schools, the fact that we are so often shown diagrams of penises, but when you look at the diagrams were shown of female reproductive organs, it's literally female reproductive organs. We're given the ovaries, we're given the fallopian tubes, but we're not taught about the clitoris. We're not taught about our vulvas so often, which is insane. The clitoris is an incredible body part. It's the only human body part that's only responsibility is pleasure. And it's got twice as many nerve endings as the head of the penis. So if you have a clitoris, like, appreciate that, because it's an incredible, incredible organ. And so my next slide is about pleasure. I think pleasure is the part of sex education that I personally miss the most. And I think that there's so much pressure on folks nowadays to be good at sex without necessarily knowing what that even means or what that even entails and where you're supposed to learn that. So many people who rely on porn and on media and on their peers, right, to learn how to be good at this thing, and are gaining so much of their self-value from aspiring to be good at sex. But really all that being good at sex necessarily means is that you're able and willing to communicate with your partner, because everyone enjoys different things and everybody has a different body. And so there's a pillar in sex education in my community that you are responsible for your own orgasm, meaning that you cannot expect your partner to be a mind reader, and even like pushing orgasm-centered sex to the side. You are responsible for your own pleasure, because you can't expect anybody to read your mind. And so you need to take it upon yourself to communicate what feels good to you, what doesn't feel good to you. And I think communication is so important, and it's not always easy. And I think, things that will help sort of lead the way are being equipped with the terminology, thinking terms like slower, faster, angle, position, pressure, maybe incorporating yes, no, maybe lists with your partners. This has been a long time practice in the BDSM community, where you sort of just list out things that you would be open to, you wouldn't be open to, and you would think about, and using that as something you can share with your partner, as like a fun game. It's totally a great idea. I think there's also a lot of shame and stigma around masturbation and self-pleasure. I felt that, especially coming from a religious community myself, but it's perfectly natural, and it's the best way to know what you like without the pressure of somebody being there. And it's not just practice for partnered sex, or something that you settle for when a partner is not around. It's its own beautiful thing on its own. It's a way to connect with yourself. It can be a self-care practice, and you can really invest in your own self-pleasure practice by looking into toys, looking into lubricants, other things, taking time to spend with yourself that you like, in a pressure-free environment and in a self-judgment-free environment. It's not easy, but it is very, very important. My next slide was on consent. I also believe that consent isn't always an easy topic to discuss. there's a lot of nuance that it requires. Planned Parenthood has an amazing model for consent, which is called consent fries. It refers to consent being freely given, reversible, informed, enthusiastic, and specific. It's a great starting point, but I also think that it can be expanded upon. Requiring enthusiastic consent isn't always the most trauma-informed way to approach the subject. Evolutionarily, there is a theory called self-motivation theory. Self-determination theory. It refers to how much autonomy you feel in each reason that you might have sex. So it exists on a scale from reasons where you feel the most agency to reasons where you feel the least agency. The most being things like intrinsic motivation, like feeling like I really want to do this, followed by moral reasons, like having sex is good for me, it's good for this relationship. And then the least agency being in things like avoiding punishment, introjective motivation, which is avoiding guilt, and then finally amotivation, which is when you just allow something to happen to you. And so when we have this understanding as consent not being black and white, but existing more on a spectrum, like almost everything does, it can really inform our interactions. And so even though consent isn't always the most simple and straightforward, I don't think that it's important to be taught because it's easy. I think it's important to be taught because it's look at what happens when we don't, like, look at how prevalent rape culture is. And so, yeah. Moving on to barrier methods, birth control, Plan C, and abortion. We spoke a lot today about sex education in schools. As far as my understanding, there are 3 models of sex education, which are abstinence only, abstinence plus, where you are taught maybe, given an overview on birth control methods, but a certain priority is put on abstinence, and comprehensive sex ed, which is the least common, unfortunately, in this country. And if you are lucky enough to learn about birth control, odds are that you don't learn about fertility awareness, your fertile window, the fact that people with vulvas can only get pregnant for about 6 days out of the month. You are unlikely to learn about abortions and emergency contraception, where to access that without having to pay as much. If you are lucky enough to have healthcare, getting a prescription from your doctor is really the best bet. How to self-manage an abortion, how to avoid crisis pregnancy centers. There's been a lot of awareness around medication abortion, which you can get through mail. It's made primarily of 2 ingredients, mifepristone and misoprostol, but incredible resource. I think Plan C pills tends to have the best abortion tracker, or the best medication abortion tracker, and information on like where you can legally and not legally get access to that. Things like even checking your condom for expiration dates or irritative ingredients like glycerin or petroleum. Like these things are not taught, even if you are taught the very basics of birth control, and even if you are told by doctors the very basics of birth control. And so unfortunately, there's a lot of research that most people have to do. There's a lot of trial and error that most people have to do. I can tell you personally, I've been on probably 4 or 5 different types of birth control because those side effects are insane. So talking about it and being able to talk openly about it, because at least a lot of my personal decisions were made on things that my peers were doing. But how incredible would it have been if I was informed through my doctors, through my family, through my school, and I didn't have to rely on the people around me and this huge trial and error process, right? STIs. So the term safe sex is sort of on the way out, and the term safer sex is on the way in, because there's always risk involved with sexual activity. And so it's more so being aware of the risk, and making the best decisions for yourself as an individual, in the goal of being safer. But looking at the current state of the world, half of our youth by the age of 24 have had or currently have an STI. And so we need to focus not only on education, but also destigmatization. We need to stop treating STIs like they're a death sentence or a reflection on your value or your cleanliness, because they're not. They're so common, and nobody talks about them. And half of the people by the age of 24 having them, like, none of us are talking to each other, and it's insane. Especially considering that all STIs are either curable or treatable. Typically, going in to get tested, you will either have a urine or blood test. It's important to keep in mind an incubation period, which your doctor might not necessarily tell you about, for infections like chlamydia and gonorrhea. It would be about 2 weeks since exposure for it to show up on a test, but for things like HIV, it's around 6 months. So looking into your incubation periods, but also looking into what you are or aren't being tested for. Standard panels typically include chlamydia, gonorrhea, HIV, syphilis, but there are things that they don't always include. Trick being a big thing that is sometimes there, sometimes not. The testing around herpes has changed a lot in the past 5 or 10 years. They will not test you unless you are presenting symptoms. Which is a very controversial decision. They will not give you a blood test, even though they have them, because the blood tests aren't necessarily the most accurate. And honestly, because the stigma around herpes is so bad that they don't want you to think that you have herpes and suffer through that mentally, and then end up not even having it, or they see that people tend to act the exact same even upon being diagnosed with herpes. And so they say, let's not test altogether, which is not the decision that I would make, but is what's happening right now, unfortunately. Sex educators generally recommend that you test every 3 months or between each new partner, really choosing what works for you in terms of how often you're having sex, and your relationship status and who you're having sex with, and all of these things like that. Finally, queer sex, I think, needs to be included in every conversation about sex education. I threw a bunch of terms up there because I thought on my slide, because I thought I would be probably running out of time. Things like topping and bottoming being a psychological term, and then dominating and being submissive being like physically what is happening. Terms like verse, switch, the use of dental dams, they're out there. People don't know about them. They are a great barrier method for people performing oral sex on people with vulvas. Medications like PrEP and PEP, which are incredibly effective at keeping HIV out of people's systems. And really, I think that we can all learn from queer sex. I think queer sex tends to be so much more, again, like imaginative and creative than, penis and vagina, PIV, penetrative sex. Sex can mean whatever it means to you. Sex is a huge umbrella term. And so I think queer folks tend to do a great job of opening those conversations up, but I think we should all be having them. And there are so many topics to discuss. I mentioned at the beginning that this is lifelong work. Things like purity culture, which I think is especially prevalent in this conversation, around religion. I think religious groups, there tends to be a certain level of purity culture, and a certain level of value that's placed on people based on their status as virginal or not, regardless of the fact that virginity is a social construct, regardless of the fact that we can't check for virginities. That's not how hymens work. Most hymens are already perforated. That's how you bleed, that's how you menstruate. So the fact that we think about the female body as sort of this like protective seal, like on a medicine bottle that you can just poke in, that's not accurate anatomically at all. Other topics include kink, ethical non-monogamy, cannabis, yeast infections, bacterial vaginosis, urinary tract infections, erogenous zones, porn literacy, racial fetishism and sexual racism, which is where I do a lot of my work, libido and mismatched libido, body positivity, the orgasm gap, it goes on. And so there really is so much to know and so many places to go to supplement what you probably didn't get. And even if you did get it, there's always more to learn. So that's my presentation. Thank you so much for having me on and letting me chat about sex for a little bit on here.
Thank you. That was awesome. I'm so glad that you could all join us today and have this conversation around sex ed, around faith, especially in the time we're living in now after the Dobbs decision from the Supreme Court. I think it's more important than ever that everybody know as much as they can about themselves and their health and their rights and their sexuality and their well-being so that we can live out our values and have full, healthy lives. So again, thank you to our phenomenal speakers, to everyone in the audience for being here today. This event was recorded. It'll be sent out to folks early next week, and as well as ways to take action and some of the resources that we spoke about today. Because as we were just talking about, learning about sex ed is a lifelong journey. We're glad to have you all on board and excited to continue doing this work. So again, thank you all for being here, and I hope you have a great rest of your night.